We're discussing butt augmentation surgery, and as previously discussed, the safest way to perform butt augmentation is by taking a patient's own fat and transferring it to the buttock area. This is called a fat grafting or a fat transfer procedure. A common question I'm asked in my practice is, where does this fat come from? And this in part determines whether or not someone is a candidate for this type of procedure. In order to use fat to increase the volume of someone's buttocks, a patient needs to have a sufficient volume of fat somewhere else. So extremely skinny patients are not candidates for a buttock augmentation. And there are other ways to augment the buttock. However, the only way that I believe is a safe way is by using fat. Therefore, in truly skinny patients who do not have a lot of excess fat anywhere else, they're not great candidates for this procedure. Patients who have at least a mild to moderate amount of fat in other places are good candidates, and we can take the fat from these other places, which include the lower abdomen, the upper abdomen, the flanks, the back, the arms, the medial thighs, the lateral thighs, generally any place where fat exists. And we can wash that fat, process it, put it into syringes, and then inject it into a patient's buttock in order to increase the size and the volume. So in terms of answering the question, where does the fat come from? It comes from a patient's own body, and generally it comes from the areas that we commonly perform liposuction on, which include the abdomen, flanks, upper back, arms, and legs.